Well, hello, welcome to the Better Together podcast. I'm your host, Mike Baker. We have another just fascinating conversation for you this week. This week, we're speaking with Monica Graybeal. Monica is the director of our pharmacy here at Heritage Health. We're going to talk about the importance of integrated teams, why a pharmacy at a federally qualified health center just feels different. And you're going to leave knowing that we have your back. And this conversations, we're going to cover all of the great things that we do within the pharmacy, talk about our teams, some great patient stories. I think you're going to love it. Well, stay tuned, and we're going to get right into it. Well, Monica, welcome. Thank you so much for being here. As we talked about in the introduction, we've got a great conversation ahead of us, talking about probably one of the best kept secrets in our community related to affordable medications, just making healthcare even better for our community. So thanks for coming on the show, and excited to have you here.
Thank you so much for inviting me. Yeah, we have a really good conversation. I'm excited to share with what we're doing.
It's going to be great. So before we get too far into it, of all the magic things we're doing, let's talk about how in the world did you end up landing in this, I want to be a pharmacist job, and then landing at Heritage Health, because you've had a really cool path.
Yeah, so, I think most people in healthcare, we all have the pretty stereotypical response, we're here to help people. But what does that actually mean? For a pharmacist, there's lots of different paths that you could take. I have worked in several areas of pharmacy, retail, hospital, and really found my home in community health. Came from an organization, another federally qualified healthcare center, was there for about 13 years. My background at that time was more clinical. Really, I was known for developing clinical programs, especially in viral hepatitis. Started a treatment program for hepatitis C that we treated patients by telehealth all over Washington and Oregon. And during that time, Heritage Health reached out to me and said, "Hey, would you like to come to us here and maybe do that for us? We have patients who need that as well." So that's how I kind of got my foot in the door back in 2020, came to Heritage Health and expanded that program here as well that's still going. And the magic kind of happened after that.
Lots of great things happen. She's being very kind. We really actually begged her to come as we were talking with her, and she says, "Mike, you have to build me a pharmacy first, and if we can build the pharmacy, then we're going to come." And we are so lucky that we did, and that we're able to be where we're at today. Let's give people that are listening just kind of a 101, people know about pharmacies and what they do, but why is a pharmacy at a federally qualified health center different, and why should anyone care about that?
So federally qualified healthcare centers are very well poised to do really what us as pharmacists wanted to do when we went to school. Sometimes I ask people, and I'll ask you, and maybe not in our community because we have excellent community partners, community pharmacies, especially some really great local independents. But what is the stereotypical experience in a pharmacy? What happens? You go to your doctor. They say, "I'm sending in a prescription." You go to a pharmacy. What happens?
You show up and they say, "Oh, we didn't get your pharmacy or your prescription from the doctor yet."
And when that happens, do they pick up the phone, or is that more turned back on you?
Yeah, I mean, I definitely have had that experience. It's really, I think patients go back and forth, and then we get it at the call center all the time. Patients calling saying, "Hey, they said they were going to send the prescription in. Pharmacy doesn't have it." I mean, it adds 5 extra phone calls and just chaos into the system. And you're already not feeling good. Why can't we just get this thing right and make it easy for people?
Correct. So federally qualified healthcare center pharmacies can bridge that gap. We have access to the medical charts. We have relationships with our wonderful providers. We have the ability to communicate back for patients and do that for them. Again, you've touched on something that's really near and dear to us. Patients aren't usually in their pharmacy because they feel great.
Right.
They're there because they need something. We're here to make that transaction easy, affordable, accessible, and to take that gap that we see in pharmacy away. Again, a lot of our local partners, they're very good at the communication. We're fortunate in that, sense. But it is a very hard situation if you're not in this field. We really want to take away that gap. So what do we do differently? We are finding affordability for these patients. We can leverage special programs that when patients meet eligibility, criteria, we can actually find affordable medications for them. We can, again, if one medication isn't covered and another is, and maybe it's more affordable, federally qualified healthcare centers are able to go ahead and switch medications out if they have those protocols. So really what we're trying to do is we're trying to practice how we wanted to practice. Pharmacists are some of the most accessible healthcare providers have a lot of expertise in medication management. So what we want to do is take that burden off of our providers, and we want to provide that continuity for our patients. So that's how it's usually different in a federally qualified healthcare center. It's not just we fill pills and we give them to you and we send you out the door. We're really an advocate for that patient, and we're a partner in the healthcare system.
Oh, I love that part. I mean, the whole thing that we've been working on here at Heritage is just building that integrated model where you show up and we have a team just ready to take care of you. And, that relieves so much burden off of the patients in the system when, if there's a problem, the provider can easily talk with pharmacists. Pharmacists can go down and say, hey, did you think about this medication? Maybe we can make this adjustment. Here's how we could make it either more effective or more affordable. I love that. I always love hearing those stories, just kind of the dialogue between the team, all so that there can be just a better outcome for the patients. And we hear that all the time. Patients just going, wow, like these guys, this team cares about me.
We have an
Yeah.
amazing team. Our pharmacy technicians, all of them are top notch. They're able to do things at the top of their licensure too. It's really about the teamwork that we have. I'm very fortunate in who we have working for us. They're just really great people.
Yeah. I don't know. I work here, so I'm biased, but I walk in and just everybody's friendly. They care. They ask about my day. They truly care. It doesn't feel like, oh, that's Mike, the CEO. Like I'm just Mike, and I love that because the team I know that that's what they're doing with everybody, and that's what people deserve in the healthcare system.
And our staffing model really allows for that. If you look at our pharmacy and you look at, corporate numbers of how many pharmacists or how many technicians are you supposed to have per prescription filled, we're very much over that limit. But the reason is we're doing more than what is currently the standard out in our community. So, we're not just the pharmacy, we're also completing all of the refill authorizations for our providers. We're looking at those and approving them for our providers. Again, how can we help our providers? How can we keep them connected to their patients and doing the work that they're very specialized in doing? They're also doing the prior authorizations. If you've been in pharmacy and a doctor writes you a prescription, you show up at the pharmacy and it's not covered. And they say, sorry, we need to contact your insurance company. We're doing those for our providers, and we're really turning around the response time on those, decreasing that and getting access to medications in a faster manner. And again, this is my wonderful team on the refill and prior authorization department. We have amazing technicians both inside the pharmacy and on this team. Really strong work from them to provide that access to our patients and make it as seamless as possible for our patients.
I think that's amazing. So when people walk in, so we talked about, I mean, they're going to have a great experience. We have a great team of locations. Let's talk about locations. Where are pharmacies located at?
So currently, we actually have 3 pharmacy licenses. We have 2 community pharmacies, so where you could walk in, get your prescription filled, talk to pharmacists at our location in Coeur d'Alene at 1090 West Park Place. Then we have another pharmacy in our Rathdrum Clinic off of Highway 41. So those are 2 standalone clinics. They look very familiar. Pharmacy technicians, pharmacists. We have our 3rd pharmacy license location within inside the clinic at Post Falls currently, but there's no people at
This
that
sounds pretty
one.
cool.
That one is pretty cool. If you've ever been, have you ever been to like Home Depot or whatever and picked up your order out of a machine, a locker?
I have.
How'd that go for you?
I love it. It's great.
Well, we did that in pharmacy. So we have a locker box that we are stocking with patients' medications that are filled. We deliver them to them for our patients. Our patients receive, just like at Home Depot or Amazon, they receive a code and they can go ahead and pick up their medications when it's convenient for them in the communities they live in. So we don't have a pharmacy in Post Falls, but we do have a locker
Oh, we do have a
box.
pharmacy. That's right.
Yes. So we're really trying to, be innovative in some of the ways we give care to patients, how they have access.
Yeah. I mean, that access is a big deal. If you're at the clinic and you have a prescription and we have it ready, I mean, you don't have to go to another place, and then you know that it's handled correctly. You've got a team behind you if you have questions. I mean, it's a really cool program. Let's talk about how you guys integrate with kind of the care that our patients are getting. So one of the things that, when Monica was talking about coming here, she said, I really want to be involved in chronic disease management and utilize the skills of pharmacists to help patients get better. And I've loved that about you this whole time. I think it's great. Talk about that just a little bit. Like, why is that different than another experience with pharmacists?
So again, pharmacists are uniquely trained in medication management. When we are doing refill authorizations or when we're talking to a patient, on average, a pharmacist or pharmacy technician talks to a patient the most out of any other healthcare professional in the system. That is a time to be able to stop and say, what's going on here? Maybe that's when we refill a blood pressure medication. Ooh, your blood pressure is out of range. Let's get you scheduled on our nurse visit to come in for a blood pressure check. Potentially with our diabetics as well. Patients with diabetes, is that we could sit there and say, maybe some of your labs are off, or maybe it's time for you to come in and talk with one of our pharmacists and get education on some new devices that could help you manage your disease state better. All these things are really cool that we can do as pharmacists. And again, if you're seeing us 6, 9, 12 times a year, that's way more than you're seeing a primary care provider. So we're uniquely positioned to be in their chart probably the most out of any other healthcare provider, and we could actually make a difference. Some of the things we're doing is, again, when we're looking at those refills, we're saying, ooh, we need to get you back in. So it's a good time to pull patients back into care and really affect disease state management through refill protocol. Really does make a difference. And we have seen with the implementation of this program is that we did see some of our metrics that we look at, especially for patients with type 2 diabetes, did improve. So we're able to really make a difference in these programs, and it's very exciting to do as pharmacists.
Oh, I mean, it's really cool because, it's just utilizing that resource. I don't think families, so there's a lot of families that are kind of in that caregiver space too. A parent might be going to doctor's visits without them, or maybe they're, kind of attending visits oftentimes, we've heard stories of, patients that are seeing multiple specialists and, prescription here, prescription here, prescription here. All of a sudden, maybe the family might not be doing as well. These are the times when, pharmacists are always heroes, but I hear these stories of, some medication reviews, get time to sit down with people, kind of explain medications to family members and the patients, but also kind of look at them and say, hey, this one's kind of fighting that one, and maybe we can adjust that. Talk about that just a little bit more, because I think there's so many people in those positions right now that it can be really scary.
100%. Especially in times after transitions of care. Transitions of care are sometimes the most dangerous point of a patient's lives. Coming out of a hospital or out of a short-term care facility, we always have openings. Anytime my pharmacies are open, our patients are welcome to walk in and say, I need some help. It happens a lot. We encourage it. Bring in your medicines. Let us go through them. Let us look what's on your medication chart. Let me see what you're taking. And again, we staff for that. That's, again, that beauty of a federally qualified healthcare center. So we're more than just filling those prescriptions. We want to educate. We want to communicate. We're, looking what's happening in other areas. Like, we're sometimes able to review records that are coming from outside facilities and really help with those transitions of care. And it's a big deal. We do see quite a few areas where this is very beneficial. So,
Yeah, we've seen patients coming in with like grocery sacks full of meds, and there's a lot of confusion, and just being organized when you're taking them. I've loved seeing that part of our pharmacy program just continue as we go through it. It's that personal service to say, hey, we can do this better, right? And it's just everything we're trying to do here is just how do we do this better? So we talk about locations and service and access. Let's talk about the pricing. So pharmaceuticals are really expensive. Why are we able to do some things differently? And we'll stay high level. There's lots of acronyms tied to all this, but
100%.
we have some things we get to access. Let's talk about that and the prescription assistance program too.
Very cool. Yes. So, covered entities such as federally qualified healthcare centers are able to obtain medications at a discounted price, and we're able to pass those along to eligible patients. Just for an example, in 2025, we sold 75,000 prescriptions. 15% of those were for or underinsured patients that have a federal poverty level below 200%. Well, so what does this mean? What type of discount? Are we talking 50 cents off a $700 medication? No, we're talking that we're able to purchase medications sometimes on pennies on the dollar. And when patients qualify, we're able to say, hey, we could pass that along to you. It's actually a requirement of federally qualified healthcare centers to do so. And we love it. Again, our mission is to provide access and to get medications into patients' hands. We have another thing called the therapeutic interchange protocol where, if one medication isn't covered or maybe is too expensive, and we could qualify patients for these discounts, we will, and we'll get patients medications in their hands that they can afford. We have some pretty powerful stories about it. I know you've heard about some of them.
Yeah. Do you have one that comes to mind you want to share?
There's several. It's a very powerful situation when patients come in and talk to us about the choices that they make.
Right.
And they're not easy choices. They're talking about choices between housing, choices between transportation, and their medication. We've had some very powerful stories from patients. And to be able to stand across the counter with a patient and say, I got you, that's real.
Mm-hmm.
And I know that my team, they feel that every day. They experience that every day. And it's something that you can't do anywhere else. Really, federally qualified healthcare centers and other covered entities are some of the only people who can get these discounts and pass those along. And that's why, we really need to have our pharmacies in these locations. When we talk again about our locker box, right? The reason why we have that is, again, access to medications, being able to get medications that you could afford in the communities that you live in. And we're really trying to push that.
And you're always going to get the best price. I mean, when you come here, we're going to do everything we can, whether if you have insurance and there are programs that you might be eligible for. I mean, our pharmacists, our pharmacy team, are always working to make sure that you're going to get the best price, you're going to get the best medication. And that, I don't know that every place gets to say that. And I think that's again, something that I love. I mean, I love the stories that I hear from your team. I mean, just patients saying, I was not going to be able to, stay in my home because these medications were too expensive. I mean, some of these medications, thousands of dollars a month. I mean, it's so crazy. And being able to connect people with these programs and make it affordable, people are, they don't have to cut pills in half or, all of the creative ways that they do that impact their health. It's like, don't do that. Actually love it when you said, like, I got you. I mean, I think that's the most important thing. Our pharmacy team has your back. And if you need something, show up and we're going to just take care of you. Yeah.
And when we get to the end of the road, right? Because at some point we're like, gosh, we really can't do anything with this one medication. And you need that one medication. Our road actually doesn't end.
Right.
We have the patient assistance program. And that's been something that Heritage Health has been dedicated to for a long time. But we then take those prescriptions and apply to the manufacturers for saying, hey, this patient needs help with this. Consistently, Heritage Health has provided over $2.5 million worth of free medications from the manufacturers to patients. We hire and people to facilitate that. Have a really great manager for that.
She's awesome.
Yes, Miss Katie out of Kellogg. She does a great job with it. But we're really proud of the fact that you're right. We want the best medication for a patient is the one they can afford. Maybe they don't qualify for all these programs, but we will go to the end of the road trying to make sure that our patients are taken care of. Lots of options, and that is what we are trained to do, is to find the best options for our patients.
The pharmacy with heart. It's such a good thing.
Yes.
And we are so grateful, for our community pharmacies out there. So Heritage, we have a long history of working with pretty much all of our community pharmacies. Early on, some of the federal rules were different, and you partnered with local pharmacy. I mean, these guys carried us for years. It was such a big deal. Some of the rules changed, and we had to bring the pharmacy in-house to keep that pricing. But just like you need strong hospitals and other healthcare partners, we are so grateful for our community partners. And you actually have to be a patient of Heritage Health to use our pharmacies. That's a little nuance that maybe not everybody understands. You want to talk about that for a second?
Yeah. So our pharmacies are open to everyone. However, in order to get those discounts, you have to be one of our patients. Like you said, our community partners are amazing. Great, really great service out there. Just kind of, again, they don't have the eligibility to pass on some of these prices that we're able to, but we're very fortunate for that. And we love it when our patients come to us. We love to say, let me try something different.
It's probably my line I hear from you all the time. Monica's always trying to think about different ways to provide healthcare and just expand these programs. Let's talk about Center for Healthy Living for a second. So we're moving all of our Coeur d'Alene locations into the new facility, the Center for Healthy Living. The pharmacy is obviously going to be a big part of that. How do you see all of those connections happening at a grander scale, even at Center for Healthy Living? What does that look like for you guys?
What an opportunity. I mean, this is what we dream of as healthcare professionals. This is the interprofessional relationships that we want when we're moving in medical, dental, our behavioral health teams, our residency, pediatrics, all these people coming together. What an opportunity to have that interdisciplinary experience. Um, it's been fun lately to watch in our current pharmacies that collaboration between us and our providers grow, and it happens with proximity. And Center for Healthy Living really allows for that proximity for those relationships to grow. What we expect to see out of Center for Healthy Living is, again, just more exposure to our patients. Maybe our patients, didn't really relate to the locker box. Maybe that just wasn't them. Well, now their provider will be in the Center for Healthy Living. So they'll have the opportunity to see us and talk with us. So we expect our service line to grow. We expect our collaboration with the interdisciplinary team to grow. We're very excited to be there and just really seeing what the next level of collaboration can be between pharmacy and the rest of the departments.
Oh, it's so cool just watching the magic at that site. Just right now, it's the behavioral health team, and then at the end of the year, everybody's going to move in, and you give that 6 months and just watch how it's going to run and the impact it'll have on the community. I'm so excited about it, and all of the work that you've done to get the pharmacy program to where it is at today, and then to be able to connect with that. Let's talk about, so we obviously have clinics in Rathdrum and Kellogg, and we service St. Mary's, and we have other locations. We work really hard to make sure that if we don't happen to have a pharmacy in your location, we work hard to kind of help you understand what it looks like to get medications from us. Talk about how we take care of our rural partners a little bit.
Yeah, so you're right. We serve a kind of a wide geographic area, and we do not have pharmacies in all of our locations. We do have good pharmacy partners in all of our locations. It is something that, when we are talking with patients about affordability, again, if you need a refill, you're talking to my team within Heritage Health, that we are explaining these options for them. It's Heritage Health's goal to expand services to where patients need. So I'm excited to see where that goes. Again, we're being very innovative with the technologies that we're testing. Again, Locker Box, we're testing that in one of our clinics now. And I'm excited to see what the future brings to see how we can continue to serve our patients, especially in our rural areas.
Yep. I mean, and you just make it easy for patients too. So a lot of patients from rural communities are coming into Coeur d'Alene, and we have hours, we're open, we make it easy for people, and we're just doing everything we can. We will have pharmacies out in our rural locations as we continue to grow. That's the exciting part. But again, it's just this whole focus on taking care of all of our patients wherever they're at to the best that we can. I like to ask, so you're a leader within the organization. I always love asking people in leadership roles, leadership can be very lonely. What's your advice to somebody that, maybe is growing up in a pharmacy world looking to have leadership at any level? What's some advice that you'd share with somebody that's kind of going into that space? How do you stay sane, Monica?
That's a great question. I'll kind of take it back to when I was hired full time at Heritage Health. Um, you have to believe in yourself, and you have to say, I'll be able to figure it out. If you wait until you know all the answers, the opportunity will pass you by. Reach out, have mentors, have a sounding board to bounce things off of, but don't be afraid to take risks and trust in yourself. Have people around you to help you, but trust in yourself. That was a very good lesson I learned with Heritage Health. I'm very happy that I took the advice, and I am still here today.
Well, we are too. Is there anything else you'd like to share with people today? I feel like we covered a lot here. We could ask, we have Coeur d'Alene Pediatrics joining our group,
Yes.
and there might be some people that don't quite know even, Heritage Health and Coeur d'Alene Pediatrics. Let's talk about that for just a second. Like, so if you're out there and you're a patient of Coeur d'Alene Pediatrics, as of May 1st, you're part of the Heritage Health family. Nothing's really changing at the locations, but one of the benefits is that patients will now have access to these medications. I think it kicks off a little bit later than May 1st for the prescriptions, but let's talk through that just a little bit.
Oh, we love peds. We actually just ordered some things that will be nice for our pediatric patients. Yes, so you're correct. Little bit of things happening in the background to be able to give those discounted prices to patients, so that you're right, that'll be more, it'll be in July when that's fully kicked off. But we love to have, patients be able to utilize us for the whole family. Um, Again, we do everything for pediatrics that we do for a general population. We're always looking for the best price. Our pharmacists are always double checking pediatric prescriptions for, is this the correct dose for the correct, indication and their weight. Our providers are wonderful, and so is Coeur d'Alene Peds, but it's just an extra layer that we do provide when we're looking at pediatric prescriptions. So we're very excited to
Right.
have
It's going to
them
be great.
on board. It's going to be a great learning experience for our pharmacies and, hopefully build that relationship with Coeur d'Alene Peds too. We hear there's some really great providers there, and we're
I
excited.
know. It's such a great team.
Yes.
This whole partnership is just going to be so great for the community. I don't know. There's so much momentum and great things happening here at Heritage Health. And Monica, there are people that come along in organizations that leave a mark. I look back to when we first started talking to where we are now. I mean, you were that dreamer that came in and put in the work. And I want to express my gratitude to you for all of that work that you put into it. It's never easy. As you go through this, you're always trying to build things and change things and set things up within a larger system. But we're so grateful for you and all the work that you've done, and which spills out to all of the patients that we've been able to serve. I mean, 75,000 prescriptions last year. Behind every one of those is a patient that got great service and great pricing on their medications, and they have this integrated, connected world that you really helped shape. So thank you very
Yeah.
much.
No, I appreciate that. I have the best team. Sorry, there's other teams
great.
here,
I
but
get it.
I have an amazing team of pharmacy technicians and pharmacists who really make this work easy. Um, and it's worth it. It's worthwhile. Our team truly does believe in our mission, and we are excited to be here. And I really can't thank my team enough. I'm biased, but I might have the best team.
I love it. We always try to tie in the title of the episode Better Together, but this is another example where things just truly do work better when we're working together. So,
100%.
all right. Well, thanks for being here.
It was
I really
an honor.
appreciate it.
Thank you.
All right. Well, thank you all for joining us this week. Stay tuned for more amazing conversations.